So today we are going to talk about the anatomy of the pharynx. So we start with the definition of the pharynx. The pharynx is a fibromuscular tube extending from the base of the skull and continue downward with the esophagus. The length of the pharynx is about 12 centimeters, and we started at C1 to C6. And here stand for cervical vertebra number 1 and cervical vertebra number 6. So it started here at the base of the skull, correspond to the first cervical vertebra, and end here at the level of the 6th cervical vertebra. And the length is about 12 centimeters. As you can see, the anterior wall here of the pharynx is deficient, so it's open here with the nasal cavity, and here it's open with the oral cavity, and here it's open with the larynx. So according to this, the pharynx is subdivided into 3 parts: nasopharynx, oropharynx, and laryngopharynx. So it's a muscular tube, so it consists of muscle. This muscle are either curved muscle or other small muscle or longitudinal muscle. So this curved muscle, we call it the constrictor muscle. There are 3 groups: superior constrictor, middle constrictor, and inferior constrictor muscle. So the fiber of this muscle run in a circular direction. Another muscle found it here is the stylopharyngeus muscle, palatopharyngeus muscle, and salpingopharyngeus muscle. And here these fibers of these 3 muscles run in a longitudinal direction. As we can see here, this is the superior constrictor muscle, and here this is the middle constrictor muscle, and this is the inferior constrictor muscle. In the coronal section here, we can see this muscle again. This is the superior constrictor, and this is the middle constrictor, and here this is the inferior constrictor muscle. The longitudinal muscle, for example, this is stylopharyngeus muscle, as you can see here, and here also this is stylopharyngeus muscle. So between this constrictor muscle, a very important things we should know is there is some structure passing between this muscle. So we have some structure passing between the superior constrictor and the middle constrictor. And as you can see here, the first structure is the stylopharyngeus muscle. And also we have nerve passing here between these 2 muscles, which is the glossopharyngeal nerve and stylohyoid muscle also. Another structures passing between the middle constrictor and inferior constrictor. Here we have the internal laryngeal nerve and superior laryngeal artery and vein. So this is about the constrictor muscle. Muscle of the pharynx. The 3 constrictor muscle extend around the pharyngeal wall to be inserted into fibrous band or raphe. So the raphe is a fibrous band that extends above at the base of the skull, attached to the pharyngeal tubercle on the basilar part of the occipital bone of the skull down to the esophagus. The 3 constrictor muscle overlap each other, so the middle constrictor lies on the outside of the lower part of the superior constrictor, The inferior constrictor lies outside the lower part of the middle constrictor. As you can see here, this is the pharyngeal ruff. Fibrous bands are running longitudinally and posterior in the midline. Attached here to the base of skull at the smaller tubercle we can see here, which called the pharyngeal tubercle. Here, this is the 3 constrictor muscle which attached to this ruff. This is the inferior constrictor muscle. And here this muscle is the stylopharyngeus muscle, attached here to the styloid process. So from coronal section, also from anterior, we can see how this tube is defected anterior and open. Here is the nasal cavity, oral cavity, and here is the larynx. So here this is the nasal septum, this is the nasal cavity, and here this is the oral cavity. Here we can see the posterior third of the tongue, circumvallate papillae, and here this is the uvula, and here also this is the epiglottis we can see, and this is the opening of the trachea, larynx, sorry. And here is the end of the pharynx at the level of C6. You see the lower part here is constricted, and here there is a muscle which is the cricopharyngeus muscle, forming the nervous part of the pharynx, and the pharynx from here continue as esophagus. So, as we mentioned, the lower part of the inferior constrictor, which arrives from the cricoid cartilage, is called the cricopharyngeus muscle. The fibers of this muscle pass horizontal around the lowest part and nervous part of the pharynx and act as a sphincter. Another dissection is the sagittal section of the pharynx. Again, this is the nasopharynx, this is the oropharynx, and this is the laryngopharynx. As you can see here, this is the C1, C2, C3, C4, C5, C6 here. So here this is the end of the pharynx. As you can see here, also some muscles. As you can see here, this is the levator villi palati muscle to the soft palate. And here this is the salpingopharyngeus muscle. As we mentioned, we had 3 muscles running longitudinal. We see one from outside, this is stylopharyngeus, and here the second one is the salpingopharyngeus muscle, and the third muscle is the palatopharyngeus muscle. So we can see from inside here the palatopharyngeus muscle and the salpingopharyngeus muscle, and from outside you can see the stylopharyngeus muscle. And here this is the constrictor muscles, as we can see, superior, middle, and inferior. So started with the first part of the pharynx, which is the nasopharynx. Nasopharynx lies above the soft palate and behind the nasal cavity. In the submucosa of the roof, there is a collection of lymphoid tissue called the pharyngeal tonsil. Here, this is the pharyngeal tonsil at the roof of the nasal cavity of the nasopharynx. Very important to know about this pharyngeal tonsil, because sometimes can be enlarged, especially in children, and lead to adenoid formation. And usually the child present with snoring, and sometimes difficulty in breathing. Usually it regress in size with time, but sometimes it need to be removed surgically. So this is the adenoid. Sometimes we call it the third tonsil. So opening between the nasal cavity and the nasopharynx, we call it the pharyngeal isthmus. Here this is the pharyngeal isthmus. This opening between the nasal cavity and the nasopharynx. Also here we had this tubal elevation, which is formed by salpingopharyngeus muscle we had seen in the previous slides. So here there is a muscle which is a longitudinal muscle, which is a salpingopharyngeus muscle, and the coverage by mucosa will form this tubal elevation. And here at this tubal elevation we have an opening, which is opening of Eustachian tube, pharyngeal opening of the auditory tube or Eustachian tube. Behind this pharyngeal or tubal elevation we have the pharyngeal recess, as you can see here. So this is the side of the pharyngeal recess, a pocket behind the tubal elevation. So we move to the second part of the pharynx, which is the oropharynx. The oropharynx lies behind the oral cavity. The floor is formed by the posterior third of the tongue and interval between the tongue and epiglottis. In the midline there is the medial glossoepiglottic fold. In each side there is a lateral glossoepiglottic fold. The depression in each side is called the vallicula. We are going to see in a minute. So here this is the uvula, part of the soft palate, and this is the palatine tonsil. Also we can see it here, and this is the palatoglossous arch. So we have two arches. The anterior arch we can see the palatoglossous, and another arch behind is the palatopharyngeus arch. Between the two arches we have the palatine tonsil. The palatoglossous arch is a fold of mucous membrane covering the palatoglossous muscle. Also this is muscle we had seen running longitudinally. The interval between the two palatoglossous arch called the oropharyngeal isthmus. It marks the boundary between the mouth and the pharynx. This isthmus, the oropharyngeal isthmus, marks the boundary between the mouth and the pharynx. The third part of the pharynx is the laryngopharynx. Here it lies behind the opening of the larynx. The lateral wall is formed by thyroid cartilage and the thyrohyoid membrane. The piriformis fossa is a depression in the mucous membrane on each side of the laryngeal inlet. Here, so this is the laryngopharynx. Here this is the epiglottis. Here this is the tongue, as we can see, and this is the vallicula, this depression. Here this is the inlet, laryngeal inlet. So the sensory innervation of the pharynx, mucosa, the nasopharynx is innervated from the maxillary nerve. The oropharynx from the glossopharyngeal nerve, and the laryngopharynx from the internal laryngeal branch of the vagus. The motor supply to the muscle of the pharynx. The main motor supply is from the pharyngeal plexus, which formed by the vagus, glossopharyngeal, and cervical sympathetic. All of the muscles are innervated by the pharyngeal plexus except stylopharyngeus muscle, which is supplied by the glossopharyngeal nerve. And also the cricopharyngeus is supplied by recurrent and external laryngeal nerve. But all of other muscles are supplied by the pharyngeal plexus. So the blood supply of the pharynx. So the blood supply came from the external carotid artery and its branch. Here first we can see this is the external carotid, and here we can see the tonsillar artery, which branch from the facial. So this is a facial, and here this is the tonsillar artery, and we have the ascending palatine artery. Also, this is another branch from the facial. Also, we had ascending pharyngeal artery, which is direct branch from the external carotid, and descending palatine artery, which branch from the maxillary artery, and a dorsalis linguale artery, which branch from the lingual artery. So thank you so much for your listening.